Добрый день, уважаемые коллеги.
Good afternoon, ladies and gentlemen. It's a pleasure to welcome you here at this panel discussion. This panel discussion is part of the veterinary medicine in the poultry industry, and it's a hybrid conference, as you might know, and you might want to send out hyperlinks. Everything is being translated, simultaneously translated into English, and if necessary, you can switch over to English that's of course possible in Zoom. There is a globe icon for choosing the relevant channel. Well, I just wanted to mention that the National Poultry Union, the National Swine Union, and the National Dairy Product Union, Alexis Consulting, are the organizers of this conference, and Vector Best has become an active participant, and we are happy about that because the practical issues pertaining to organizing the conference are of topmost importance. And, vets are represented here in a greater number, which is one of the benefits featured by this conference as opposed to conferences organized by the public authorities and so on and so forth. The first presenter is actually me, is it? So I'd like to talk to you about the trends in poultry epidemics in the past few years. And actually, this panel discussion is going to be devoted to new challenges that we've faced in the past 2 to 3 years. If you have any ideas that you want to share with us, you're more than welcome to do that during the panel discussion. Let's start with listeriosis, if I may. It has always been a serious problem, and I believe that this pathogen is way more important than salmonellosis. And I believe that salmonellosis has been politicized to a great extent, especially as far as the poultry industry is concerned. In the past 2 years, we've seen a five-fold increase in mortality amongst humans caused by listeriosis. It might have been partially caused by the COVID-19 pandemic because, a resistance to bacterial infections is going down, and listeriosis causes various problems in humans, and it is also worth mentioning that the septic form of listeriosis causes a high mortality. We're talking about 80%. 80% of infected patients can actually die. And the five-fold increase in mortality is actually underappreciated, an underappreciated figure. Many experts point out to Listeria bacteria prevalence increase in the poultry industry, and Listeria is now isolated all year round. Listeria is now isolated in live birds, which means that it's no longer a problem for the meat processing industry. And cross-contamination is now a forefront problem. Pathology examinations demonstrate various changes associated with listeriosis, which means that livestock might be infected with listeriosis. That causes damage to the central nervous system, and oftentimes it's mistaken for the Newcastle disease. On the one hand, the head is not turned, as is the case with the Newcastle disease, but the lack of coordination, tremor might be some clinical signs. And during pathology examinations, we see the damage to the heart muscles caused by listeriosis septic infection. Listeriomas and so on and so forth are the classical clinical signs, and the microscopic examination of the cortical tissue of the brain also demonstrate bacteria in the lesions, and this is typical for listeria. At the same time, it's worth mentioning that in Russia, ELISA assay is now used to diagnose listeriosis, and however, there are no express tests, ELISA express tests for poultry, and the versatile express tests are no longer available in the Russian market, which makes serology monitoring more difficult. So one of the questions is how come within a very short period of time we have faced an increase in the prevalence of listeriosis in the poultry farms scattered all across Russia. What is the common factor that might have impacted that? And by the way, foreign counterparts say that the prevalence amongst humans is going up, which means that humans can now be a source of infection of the poultry and vice versa. The poultry has become a greater threat for humans since they can be considered a source of listeriosis. And the molecular research shows that this is the listeria strain that can be found in food products that were eaten by infected people who later died. Previously, these strains found and isolated in the food products were not similar to the strains that caused mortality in humans. I personally believe that the express tests, I'm sorry, vector based, but I believe that express tests should be more flexible, and the Soviet era agglutination-based tests were quite versatile. You can diagnose a disease from the samples taken. The sensitivity might not have been high, but if you use them in the poultry form, and if you know for a fact what microorganisms you're looking for, I believe that such tests are quite acceptable for diagnostic purposes. And it's a very important tool to better understand the source of Listeria bacteria and their prevalence in the live birds that do not die of listeriosis. We're not looking for the cause of mortality because there are no grounds for that. We don't need to do microbiological diagnosis in live birds. However, sometimes we confuse it for the Newcastle disease and encephalomyelitis, which means that we need pathology based monitoring. For instance, if you see a lesion like that, if you see a lesion like that too frequently, and if it is accompanied by various nervous nervous system signs, then you should look into the listeriosis problem in your poultry farm. And if you wanted to protect your food products, you need to focus on live birds now as opposed to meat processing stage.
То есть, повторюсь, нам нужен ПЦР-мониторинг листериоза.
That means we need to run PCR monitoring, we need to run serology monitoring for listeriosis diagnosis purposes. Some parent flocks might be the source of listeriosis, and that means vertical infection. We need to closely monitor the blood of day-old chicks and 3-day-old chicks for Listeria monocytogenes. If you have any questions, by the way, you're more than welcome to ask them right away. Another question is, what do we do with live birds? Should we use antibiotics or antibiotic growth promoters, AGPs, or vaccination or prevention, or we don't do anything and just focus on the end product? The second question, I don't like talking about the avian influenza because everyone talks about that. However, avian influenza changes all the time. It's a given. And the problem might become more aggravated down the line. And the main question is, should we vaccinate the poultry against highly pathogenic avian influenza? Please raise your hand if you support this opinion. I see 6 people raising their hands. Who is against? 2 people are against vaccinating poultry for against highly pathogenic avian influenza. One of the arguments is, how do we control circulation of a highly pathogenic wild strain? If you focus on the M class antibodies in vaccinated poultry, sometime looking forward, you will no longer see the class M antibodies, and that will help you to effectively monitor the circulation of this pathogen. Some experts say that some of the poultry should not be vaccinated and monitored with the serology techniques. In other words, the methodology is out there, and we know how to timely identify and diagnose the problem.
Вот пример птицефабрика.
Let me give you the following example. This is a poultry farm, 2-day and 3-day-old chicks. We evaluate them for class M antibodies. In other words, inactivated vaccine is administered to the parent flock. They are not infected. However, in the broiler flock at day 24, we see some indications and well, some dubious indications, and then we get some positive results for avian influenza. And we see the same thing when we use the classical techniques such as ELISA assay for avian influenza. The Y class antibodies are there, and some of the chicks have antibodies, some don't, and the risk of wild strain circulation is still probable both in the chick flock and the parent flock. And that means that the chicks who have not been protected during the first 10 days might be a factor that contributed to the spread of the low pathogenic avian influenza in the broiler flock. But the same could hold true for the highly pathogenic avian influenza. The second thing I want to mention is that rodents might be, mammals could be a source of highly pathogenic avian influenza. For some reason, we ignore swine farms, humans as a potential source of avian influenza. And of course, you will not be able to isolate classical strain in humans, but if they don't wear personal protective means in one farm and then visit another farm, they could cross-contaminate the poultry farms. And for some reason, in Russia, visitors to poultry farms do not have to wear masks. It's a strange approach, but there are poultry farms who provide you with every single piece of personal protective equipment, including masks, and that is the right way to go. And prevention is worth an ounce, and an ounce of prevention is worth a pound of cure. And personal protective equipment is a good way to prevent various diseases, including the Mark disease and so on and so forth. Nevertheless, let's go back to the mammals. The avian influenza has adapted to mammals in Europe, and these strains will affect vets as well, because humans are also mammals, and that means that we will spread the virus around. For instance, if you have an outbreak of avian influenza, you need to at least run PCR tests on other animals, not just poultry. And by the way, swine farms, pig farms are the main source, because the upper respiratory tract is a good space for the avian influenza virus change and evolve. And the swine fever might mix with avian influenza, and that would cross-infect the humans. Why do we not control that? It's still a mystery to me. And maybe public authorities are not concerned about that, but we should be concerned about that. Technically wise, it's possible. I'll try to be brief as far as the fungi are concerned. Well, there are different views. By the way, how would you diagnose this disease if you hadn't seen the name? You might have said that it's an active mycosis. It could be one of the versions, but it's not. And it's not aspergillosis. It turns out this is the penicillium influenza, but the concentration is way high. And the outbreak was observed in several poultry farms simultaneously. Last winter, it affected many poultry farms because of the vertical cross-infection. For instance, we found fungi on eggshells. And the parent flock, the breeder flock, was the main source. That's why it affected several poultry farms simultaneously. And fungi spores can withstand disinfection, and in high concentration, it caused high mortality in chicks. The mortality was observed in chick flocks with 20 to 30 days old chicks. Another good example, endocarditis, bacterial endocarditis followed by pneumonia. And this pathogen is very sensitive to doxycycline, and it can vertically contaminate broilers. Layers are not as affected as broilers, but it also affects the musculoskeletal system. And the survival rate might go considerably down. We still don't know what the risks for humans are. And this infection might be a problem. Mammals are affected, by the way. And the biosampling proved that within 3 hours, acute infection kills off most of the mice. And the chronic disease affects most of the pregnant mice because of the placental insufficiency. Non-infectious pathologies are also a problem. Vitamin deficiency is a huge problem. Vitamins are expensive, or we lack them. We started using other suppliers, and we don't know all the features inherent in them. And what we see right now is a great number of diseases that we treat as infectious diseases initially. For instance, we see liver damage, inflammation in the intestinal tract, diarrhea syndrome in adult birds when they start getting more oil, and so on and so forth. And we see balls like that, lipid-like balls, which are not soluble in the liver, kidneys, or the intestinal tract. And oftentimes, macrophages try to consume them, and we see clots in the spleen, for instance. Spleen might look as if it were affected by the Newcastle disease or the avian influenza, but then we start seeing in infarctions and this in the fluorescent microscopy, we see this, and in quite a number of poultry farms, this is a huge challenge. And the vets see it as a contagious disease, and they associate it with something unknown. The chemical experts don't tell us anything. Vitamin E deficiency might be mistaken for the Newcastle disease or avian influenza because it affects the central nervous system, CNS. The muscles look white. In other words, it could be mistaken for necrosis. Pneumonias might be a problem. We don't see any parasites in the histogram. This is eosinophilic myositis, and it could be called an autoimmune pathology because the because of the antioxidant deficiency and vitamin E deficiency, and the immune system goes horribly wrong. The inflammation mediators are released into the bloodstream, and any trigger, for instance, vaccination or anything else, might cause the light infection evolve and cause various problems such as pneumonia and high mortality in poultry. And that means that we need to assess vitamin E levels as well. In the past, we never did that because vitamin E was quite cheap, but now vitamin E deficiency causes various problems in practice. Let's move on. Vesicular enteritis is something that I take a close interest in. You might know that it is associated with lower efficacy of vaccination against the Newcastle disease. It could cause AIL and the Marek disease outbreaks. And that's exactly what we're witnessing today. The Marek outbreaks, it affects spleen and gastrointestinal tract. AIL affects lungs and liver, and this is a typical image. The vesicular enteritis affected primarily small intestine. Now it affects the entire gastrointestinal tract. And the feature of this virus is that it destroys the fibroblasts, in other words, the connecting tissue cells. Not only are they destroyed, they are no longer separated by the connecting tissue. And we might find some interesting changes in the cytoplasm. The color changes because of the eosinophils. These are the crypt remains. Candidosis outbreaks or have been registered in most poultry farms. Hepatitis, foam content in the gut. Well, vets might mistake it for Clostridia caused infections, and yeast-like fungus. The mortality reached 10% during the first 2 weeks after hatching. And what should a vet do if the mortality goes up considerably? Antibiotics, right? But Candida just starts spreading faster. And an interesting case was a vet stopped giving antibiotics to the poultry, and candidosis disappeared. Disinfectants are not a help because it still remains on the eggshells. Histaminosis is familiar to everyone, but cryptosporidiosis is now more prevalent than histaminosis, and we don't have any PCR tests to identify such diseases. Tetratrichomanosis is an understudied disease, but it's still diagnosed, and it affects the entire gut tract, causes pneumonia, tracheitis, and vets start thinking about infectious tracheitis, but it's not. Proventriculitis might be mistaken for the Newcastle disease, bursitis, and we start treating the poultry for the Gumboro disease, but actually it's cryptosporitis caused infection. Well, and that brings me to the end of my presentation. Thank you for your attention. Any questions? I hope the next presenter is ready. And are there any questions from the floor? There are questions from the floor. Let's go back to the trichomanosis. Circus experts turned to us for help a couple of months ago, and this disease was a problem for them. But what's the difference between the one that you mentioned and the classical trichomoniasis? Well, it's more specific for chicken than as opposed to the classical trichomoniasis that primarily affects pigeons. And I don't think there are significant changes, significant differences. Typhlitis with might be confused for lichen type diseases. You might find white lesions looking like scars on the liver. And if you see an image like that, then you might diagnose tetrachomoniasis. But nevertheless, we still need PCR tests to be able to differentiate between the various critosporidiosis types. And, there are differences between the subtypes, and current PCR tests might not help you here, and histology takes too long, and it's difficult to get the statistical data. Therefore, we do need PCR tests. Another thing I wanted to clarify is the vitamin deficiency. By the way, we have vitamin producers here in this room, and they would probably confirm what I'm going to say. In the past few years, we've started seeing the following. Vitamin E is very expensive. Therefore, vitamin E is being replaced with the so-called natural antioxidants. And the matrix, for instance, polyphenol replaces vitamin E, and unfortunately, vitamin E concentrations go down significantly. Vets tend to forget that vitamin E is not just about antioxidant function, it is also about the synthesis of antibodies and hemosynthesis. And the vets then start complaining that their productivity parameters go down. Of course they would. Moreover, the antioxidant action mechanisms are different, and they all have different mechanisms. Some of them block free radicals, and that is why we started getting lots of complaints about deteriorating performance indicators. So be careful about replacing vitamin E with antioxidant. And vitamin E might come in different forms and in different concentrations in different drugs. When genetics companies meet your specification requirements, keep a close eye on the tocopherol, and tocopherol concentrations will never be 100% because the molecular mass will be affected by the end compounds. Any other questions? I have a question about avian influenza. You stated that ELISA assay is more effective than PCR tests. Would you please care about commenting on that? Well, if we're talking about low pathogen avian influenza, I'm actually a strong proponent of ELISA assay. As far as the highly pathogenic avian influenza is concerned, antibodies might not be too pronounced, and the mortality might start be a problem much earlier. Serology diagnostics for identifying the circulation of highly pathogenic avian influenza in vaccinated poultry that might be infected but might not die of avian influenza would be a good way. I believe that it might be an effective way to diagnose highly pathogenic avian influenza in vaccinated birds.